Good morning, good afternoon. Welcome to today's presentation, Supporting IENs to Relaunch and Flourish in Their Nursing Career in Canada. Before we begin today's presentation, we would like to begin with an acknowledgement that N4 is hosted at CHEO, which is located in Ottawa, Ontario. Ottawa is built on unceded Algonquin and Anishinaabe territory. The peoples of the Algonquin and Anishinaabe Nation have lived on this territory for millennia, and we honor them and this land. Their culture and presence have nurtured and continue to nurture this land. We also honor all First Nations, Inuit, and Métis peoples and their valuable past and present contributions to this land. My name is Colleen Drake. I am N4's Project Engagement Coordinator. I will be hosting and moderating today's presentation with my colleague and co-host, Andrew Tomeyer, N4's Education Coordinator, who will be monitoring the Q&A box today. I am now pleased to introduce you to today's presenters, and I'm going to ask that Rola and Meghan turn on their video as I introduce them. Welcome. Rola Moubadder is Program Manager of Care Center for Internationally Educated Nurses, an organization that supports IENs pre and post arrival to relaunch their career in Canada. Rola brings 24 years of a broad range in health, clinical informatics, nursing education. Rola has held several positions as a professional education consultant, professor, assistant, and quality consultant in Canada and internationally. Rola is committed to supporting nurses nationally and internationally, mentoring, facilitating workshops, influencing policy, and improving the quality of nurses during nurse practicing in a diverse environment. Recently, Rola authored a book with over 300 other authors about mentorship in nursing mentoring programs, mentoring in nursing through narrative, mentoring, focused on the success transition of IENs to the Canadian workplace through mentorship of IENs. Her fellow nurses and nursing leaders have recognized her as an inspirational nurse leader dedicated to serve the nursing profession. Meghan Wankel has spent the last 17 years working in the nonprofit sector in India, Egypt, and Canada. She is with Care Center for Internationally Educated Nurses since 2014 and has coordinated pre-arrival supports and services programs since 2016. Has provided case management and to over 1,500 internationally educated countries of residence planning migration to Canada. Since 2014, Meghan has been involved with the Employment Resource Connections Action Group with the Toronto West Local Immigration Partnership, chairing the group between 2017 and 2021. She has a Bachelor of Science in Political Science from University of Toronto, a postgraduate certificate in International Project Management from Humber College, and a Master's of Migration and Refugee Studies from the American University in Cairo. Welcome to you both. And I apologize, my internet connection may be slightly cutting out. So if there were any flexures in my introductions, apologies. Welcome to you both. And I just have a few housekeeping slides to run through, and then we'll jump into today's presentation. So today's session is being recorded and will be uploaded to our N4 platform. We will share this with you as soon as it becomes available. Should there be any technical issues during this presentation, we'll inform you with details for an alternate makeup session. Before we begin today's event, I would like to take this moment to introduce you, our audience, to the features and participation experience. Throughout today's session, we invite you to write your questions in the Q&A window. We know that sometimes many of you might have the same questions or be interested in particular responses. Today, you have the option of upvoting questions. Please upvote your questions and we'll bring those forward to our speakers as soon as possible. And with that said, I am happy to pass the virtual mic over to our presenters to take it from here. Welcome. Thank you.
Oh, just realized I'm on mute. Sorry about that, everybody. I was just saying thank you so much for hosting us today, and it's a real pleasure to be here. And I'm attempting to share my screen, and I don't think it's showing up properly. So let me just try this once more. And of course, this works perfectly in our trial run. Can everybody see our slide deck?
Yes, we can see your slide deck.
Wonderful. Thank you so much. Well, before Rola and I would get started, we would actually like to do a land acknowledgement for where Care Center is located in Toronto. So we would like to start today by honoring the land we are on, which has been the site of human activity since time immemorial. It is the traditional territories of the Huron-Wendat, the Anishinaabeg, the Chippewa, the Haudenosaunee Confederacy, and most recently, the Mississaugas of the Credit River First Nations. Ontario is covered by 46 treaties and other agreements and is home to many Indigenous nations from across Turtle Island, including the Inuit and Métis. These treaties and other agreements, including the One Dish with One Spoon Wampum Belt Covenant, are agreements to peaceably share and care for the land and its resources. Other Indigenous nations, Europeans, and newcomers were invited into this covenant in the spirit of respect, peace, and friendship. We are all treaty people, and many of us has come here as settlers, immigrants, newcomers in this generation and generations past. We're mindful of broken covenants, and we strive to make this right with the land and with each other. We would also like to acknowledge those of us who came here involuntarily, particularly as a result of the transatlantic slave trade. And so we honor and pay tribute to the ancestors of African origin and descent. And Andrew has shared some poll questions that we're very interested in who is able to join us today. So the first question Andrew has shared is, are you an internationally educated nurse or working for an organization that supports IENs? Oh, great. And a quick response. That's so great for us to know. Thank you. And I see lots of healthcare employers here. That's wonderful. We have a few more questions. Question number 2, where are you joining us from? Oh, that's great. Okay, thank you, everybody. Nice to see cross-country representation. Question number 3, if you are an internationally educated nurse, have you started your assessment process with the NNIS? Or since we're pan-Canadian today, if you've started with the NCAS, if you're out west, or I don't think anybody is listening in from Quebec, but if you've also started a regulatory application, any of those options. Okay. Great. So lots of folks supporting IENs here, which is wonderful. Question 4, and I'm not sure if this will apply to folks, but are you already registered as a registered or licensed or registered practical nurse seeking employment strategies and or workplace transition and integration support? All right, so we've got a few people who are, and others who are interested in workforce integration, which is wonderful. And last question, how did you hear about us? Us being Care Center. Oh, friends and colleagues got a very high percentage. That's really nice to see, as well as the other venues and the partner organizations. That's wonderful. Well, welcome everybody. We're very glad you could join us today. And Rola and I will be talking about Care Center and the supports that we offer to internationally educated nurses. We offer a pan-Canadian pre-arrival program. Post-arrival, our work is done solely in Ontario, but we're fortunate to have a network across the country for folks who we can refer to in our pre-arrival going to other destinations. A snapshot of Ontario, where we're based, Ontario and pan-Canadian nursing registration trends, some of the challenges and barriers that internationally educated nurses going into their first job in Canada can face, how employers can support IEN workforce transition, what we have found that internationally educated nurses new to Canada need, and the supports that they require for success. We'll talk about we do extensive employment work at Care Center, including a well-developed mentorship program, what inclusion means for internationally educated nurses, employers, and the Canadian health workforce, strategies to help nurses pursue career pathways and foster inclusion in the Canadian health sector, and ending with some in-demand skills that internationally educated nurses need to succeed in the labor market. So Rola, I will pass that over to you for the next few slides. I'll keep controlling the slides.
Thank you so much, Meghan. Thank you, and for team, and thank you for all the audience, friends, colleagues, IENs from across the nation or maybe globe. Thank you for joining this session. I'm so happy to be here today and to be of any support and help to the call of how we can work together to integrate and transition the internationally educated nurses, being one of them. So I'm Rola Moubadder, and I'm the program manager at Care Center. And I'm happy to share with you how we actually support IENs through their journey. So this flow chart, it's about all the kind of steps needed for an international educated nurse to kind of get registered in different provinces and under regulatory bodies, and also to establish or relaunch the career in Canada and in Ontario. So at Care Center, we have a one-on-one model of case management, which helps and support individual clients to achieve their career goals from the initial pre-arrival, maybe before coming to Canada, to put their application for registration, navigate the system. So we offer guidance throughout evaluation and verification of education and their nursing practice. Like for the Ontario College of Nurses of Ontario, they require them to still go through the NNAS process, which is the National Nursing Assessment Services, while in other provinces, they actually have different pathways. And Meghan will talk about the changes that has happened recently and all the different requirements by the regulators for registration. We take actually a lead in ensuring that all IENs that choose to become Canadians or to come to Canada as immigrants, keeping in mind as well the ethical kind of aspect of recruitment, that we do not ask any nurse to leave their home country, but by choice, IENs like myself would choose to have Canada as their home. So for them choosing Canada to become home, so we need actually to ensure that they expertise are been valued and utilized to the optimum. So through this, we ensure that they are employed and have access to employment in healthcare, because as I will always, our ED would say, we don't want any IEN to be working anywhere else except in healthcare system. And through this, we ensure that we help them to navigate their options, their pathways to registration, whether they are in Ontario, for example, they are eligible to be an ASPAP, which is under the supervised practice experience partnership program, or if they are eligible to have a temporary license. Then moving forward, we look at different models in terms of if they are eligible to write the registration exam. We have all the prep courses related to this, whether it's an NCLEX, whether it's an RNCAP, which is all actually been actually identified through the assessment process. Also, sometimes they will be required to go through academic pathways to bridging programs. And through this, we also help them to navigate what are the best programs that would meet the educational requirement by the regulator. I'm talking here about the College of Nurses of Ontario. As well, all through the process, we keep mentoring, guiding, and supporting the IENs, as I said, with their individualized career pathway goals. At the end of their process, and we definitely will be aiming together for their registration and become registered RNs or registered practical nurses, then we make sure that their skills have been matched to the employment profiles that needed in the sector and clinical setting. So let's say we have a critical care nurse back from their home country, and they come to Canada through the registration process. We work in partnership with our employers all over the province for our STARS program, to ensure that they are actually employed in the critical care setting, or to be at least prepared through certain certificates or through their mentorship to become critical nurses in Ontario. So that's through as well our workplace transition and inclusion, which we're going to talk about this more. I might spend more time on this slide because actually, as it summarizes, it brings as well more to discuss further and to take you through this information. So the next slide, thank you so much, Meghan. So as I look at this slide, it brings so much pleasure to me, thinking about there has been actually work done. Thinking 13 years back when I actually migrated and started my journey to become registered in Ontario, it was actually a bit of a challenge for IENs to start the journey to have their educational credentials being verified. And now it is becoming more and more, I would say, a smoother process. And regulators, especially if we look at the College of Nurses of Ontario, has been looking into modernizing the registration process, implemented, as I mentioned earlier, the ASPAP program and the temporary license, and also worked on the language proficiency requirement by easing it up, taking into consideration the multiple requirements, which are 8 requirements. So one of those requirements could be the language proficiency. They actually looked into the different assessment tools and approved most of those assessment tools, trying to match them with the immigration process as well, and all the language proficiency requirements through immigration pipelines. So looking at this slide, yes, there has been improvement. If we look at the number of IENs who applied through the years, we can find like there is a lot of IENs actively pursuing the registration. This is the statistical data from the CNO and from the Fair Registration Practice Reports as well from the Fairness Commissioner. So we can find that there has been actually quite increase in number from 2020, from 2019 and from 2018 up to 2021 and 2022. So that was a big achievement or a milestone, I would say. As of 2022, a total of 5,125, which is 41 of newly registered international educated nurses joined the CNO for the first time, which means they become registered in Ontario. So that was more than double those in 2021 and triple the number in 2020. So that brings promising hopes that we are on the right track in ensuring that the IENs are becoming registered. So the number of additional registration from nurses with international education also more than doubled in 2022, increasing from 785 to 1,834. And this is from the CNO new registration report 2022. So being a care center, I would say alumni, being a care center staff and being an IEN, we're proud to say that we piloted in 2020 as the pandemic had actually put a burden on all over the world and Canadians as well. So IENs who were trapped in Canada, they needed to refresh their evidence of practice, and they needed to travel back home at that time to do the evidence of practice placement, and they couldn't travel. So Care Center, with partnership with many partner employers and with the support of the CNO, we piloted the evidence of practice, which turned to be this SPAP later on. So looking at the numbers that the SPAP actually prepared IENs to become registered, that brings actually so much joy and delight to me and to Care Center team. So as of March 17, 2023, CNO has registered over 1,500 nurses through this program. And this is, I would say, a very successful and promising program. And hopefully we'll continue to see more IEN registered, because it brings them as well the opportunity to be mentored and supervised and also being included and integrated. So that's the beauty of this program. I'm sorry if I'm taking so much time, Meghan, please, you can move forward.
I think we're still okay for time.
More things to celebrate, I would say, and more things to speak about and see the modernization and the trends through the years. So College of Nurses of Ontario had actually committed to the modernization of the registration process and for IENs. And I would say part of that was because of the pandemic had actually, as I said, unfolded and further exacerbated the shortage of nurses was I would say, on the benefit for the IENs, but at the same time, looking at the value that the IENs bring through their expertise and through diverse multiculturalism to our healthcare system. So the CNA, the Canadian Nurse Association, had projected nursing shortage of up to 76,000 RNs by 2022. And that was, I would say, amplified with the pandemic and post-pandemic, the phase that we are facing now. Like hearing over the news, like there actually some emergencies are actually obliged to shut down because of shortage of staff and all healthcare providers. So very, very sad to hear this, and very happy to see that there is actually kind of changes in the patterns of registration process, and the trends are more, as I said, more promising for an expedited and more smooth and streamlined registration process. So if you look at the CNO website, and for those actually colleagues or partner employers or those who've been in the Canadian healthcare system, they already are familiar with the College of Nurses of Ontario website and all the updates. But for our fellow IENs, if they're not yet actually very familiar with the website, so if you go to the website, they have actually announced that there is actually a section about nursing data in Ontario, and this gives you how many IENs have been registered, how many have been employed, and a different gender kind of categorization, different areas and chapters as well. So it's good to have a look at this. So there is more enhanced transparency through sharing data and applicant statistics. There was more incorporating principles and practices of diversity, equity, and inclusion, commitment through policies and through practices as well. And also with this as well comes to employers recruiting IENs, having more actually support by training and mentorship, and as well more focus on strategies to retain this diverse, I would say, group of IENs, of staff. Enhance collaboration and engagement with diverse stakeholders to better understand IEN circumstances and address barriers to registration. On this note, we just attended the council meeting of the CNO, and they actually shared with the public the changes they want to implement, proposing to implement about the recognition of education from the abroad for the IENs. And this is as well, I'm happy to be a part of this. Whoever is actually aware of that, please, your voice means. So please go to their website and put your thoughts in order to support as well the call to expedite and smooth the process further, with ensuring that public safety is taken care of and ensuring safe practices. Definitely that's the top priority of all regulatory bodies and as well of the College of Nurses of Ontario. So to wrap this up, and there's the link for the report as well for fair registration. I would say, yes, modernization of registration process to meet the needs of the healthcare system is implemented, under implementation, in progress for further modernization, and to expedite the licensure process, as I say. Thank you. Next, I'll leave this with you, Meghan. Thank you.
Thank you so much, Rola. Yeah, as Rola has mentioned, the regulatory landscape across the country is evolving very, very rapidly. We just included a few examples on this slide of some of the changes happening across the country, designed to expedite licensure. As we mentioned earlier, applicants seeking licensure in British Columbia and Alberta don't necessarily have to use the National Nursing Assessment Service. There are other options for educational evaluations. You can see there are provinces that have designated countries where if you were educated in countries like Philippines, India, Nigeria, the US, you are fast-tracked to licensure and can practice unrestricted with passing the NCLEX. There are also designated country pathways in other provinces designed to expedite the timeframes. And Rola just brought up what's happening in Ontario. I believe until the end of November, people have the opportunity to give their feedback on the changes that they're considering. So they're currently engaging in public consultations. Rola mentioned they're considering removing the education equivalency requirement, accepting nursing education from any jurisdiction, but while requiring applicants to potentially complete an integration course before getting licensed. So it's a really interesting time to pursue licensure. It can be confusing for the internationally educated nurses we're connecting with through PASS who are going to any province and territory because of the inconsistency and kind of the lack of clarity right now. Some people are still determining which province to seek licensure in. So they're, thinking, if they're from a designated country pathway where they'd be eligible for that. So it has been really interesting to witness. So that can be, things are changing and it's getting less burdensome, but it can still be a bit complex to navigate. Of course, the financial burden. Fortunately, there are a lot of financial supports for nurses to get through the licensure process after they get to Canada. Across the country and the provinces are kicking in supports in many cases. There are microloans for new permanent residents to help with the credentialing costs. These are generally not available until people land in Canada. So, they're given the instruction in our pre-arrival services that the process can be long and complex. Start as far in advance before you get to Canada as possible while you're still outside of the country. And there's definitely some financial implications to that. And some people aren't able to do that. Which isn't great because, they have limited 5-year safe practice windows in most provinces. So you want to get through the process as quickly as you can. The educational credential evaluation they go through, of course, meeting the licensure requirements, which we have a lot of supports at Care Center to help with that, exam preparation, language and communication supports. Of course, accessing employment. So once people people are often accessing employment in temporary non-licensed positions, but then once they're looking for regulated nursing professions, there's barriers that can arise that I know we're all familiar with, including the preparation, interview techniques, Canadian style resumes and cover letters, knowing, the cross-cultural piece of successful workforce integration, finding work commensurate with expertise. It can be a little frustrating for really experienced nurses to kind of feel like they're starting over a bit. IEN integration, lack of familiarity with Canadian healthcare settings. We do a lot of work at Care Centre around this issue, both pre and extensively post-arrival in Ontario. We're also really trying to push internationally educated nurses to consider rural and remote settings, including working in Northern Canada. And we like to promote the CNA specialty subgroup, the Canadian Association for Remote and Rural Nurses, making people aware of the upsides and the downsides of working in rural and remote areas, but knowing that their skills are so needed there. Rola mentioned earlier about, ensuring equity, diversion and inclusion strategies in the workplace, making sure the workplace is a safe, welcoming and inclusive place for IENs to thrive, and settlement and housing supports. So we're very lucky at Care Centre to have our network with the settlement agencies who can help out with these issues while we're helping them navigate the assessment process and to get employment. And I know Canada's not unique. There are demographic realities impacting most countries around the world now, but here too, with our aging population, very high needs in community, rural and remote settings. We're trying to make nurses we work with more familiar with long-term care and potentially getting interested in those settings. The realities we brought up in the last slide of currently underutilizing the skills and talents of IENs. We facilitate a workplace transitions program at Care Centre, working with employers on successful IEN integration. So definitely, I see a lot of employers are here today, which is incredible. Please do reach out to Rola and I. I think Andrew put my email in the chat. And, we're happy to talk about that, about how we can support employer recruitment and successful retention for IENs. And along with our, I think, 22 formal hiring partners, we do probably once or twice a month meet the employer sessions for people who want to connect and present their opportunities and their incentives for hiring internationally educated nurses to our pre and post-arrival nurses that we're working with. And of course, I'm preaching to the choir here, I know, but internationally educated nurses bring such incredibly high value. Any employer is so lucky to have an IEN in their employ. Refined skills and expertise from home that contribute to the healthcare sector in their new home here. Depending on the province, I think IENs are still only comprising around 9 to 11% of the overall nursing workforce. And that's still a pretty low figure, I would say, not due to the lack of opportunities. Statistics Canada has shown a 77% surge in nursing job vacancies since 2015. But it's the barriers, some of the barriers we discussed earlier, I think, are where people encounter challenges entering and integrating into the workforce. And as I mentioned, that does include familiarization with Canadian culture, nursing accountabilities, professional practice standards, navigating the registration requirements. And Rola, I'm going to turn it back to you to talk about what IENs new to Canada need.
Thank you so much. I'm going to pick on where you actually kind of wrapped up your slides, Meghan, regarding the evolving and everlasting changing environment in the healthcare. And yes, we're not preaching to the choir because they already know, especially our colleagues and stakeholders from partner employers. What I would say is, now, since there's a lot of movement towards modernization and towards expediting the registration process, so I would see like more actually a commitment from our side at Care Centre especially when I'm thinking about our STARS program, which is actually, if I want to go word by word to say, it is about supports, training, and access to regulated employment service program, which is provides IENs one-on-one case management and a lot of other services like communication and nursing and all others. Still, we find we need to as well work hand in hand with our stakeholders, associations, and partner employers. Thinking of this, and this is maybe wrap up this slide. When I'm talking about this, I think about my chapter book about mentoring, being a strong believer of, as a nurse educator for so many years, of the invaluable impact of mentoring on both mentors and mentees. And there's a slide about this, but I'm going to say we need to have a mutual, I would say, understanding of the needs and requirements that an IEN would need in onboarding, as you mentioned, and transition and integration and inclusion in the workplace. So yes, this is a slide says, what do IENs new to Canada need? Which we can support them, but also we can provide them with the information. We could have a one-on-one case management support. We could have them navigate all the assessment. We can do for them a nursing readiness assessment, which will actually identify their knowledge and competencies and skills gaps in a Canadian healthcare context based on the professional practice and the standards of practice. And for example, talking about Ontario, the College of Nurses of Ontario, counseling them into the different settlement things that they need as a newcomers, to all the type of counseling needed in their, if they already kind of pursuing a pre-registration career as a personal support worker or other actually kind of external positions. But at the end of the day, after they actually kind of providing them with all of these informations, we still need to work with our, as I said, stakeholders and partner employers in order to ensure the transition is smooth and in order to support as well the managers, the preceptors through our workplace transition, to ensure that we're not only helping them to access to employment, and employability, but also looking at it as sustaining a career and advancing their career in their areas of expertise for a future better healthcare system with nurses who are really equipped, diverse, and skilled to do what they need to do. Thank you. We can go to the next slide. So again, I'm going to go through this slide a bit quicker. So I mentioned most of these, and Meghan had mentioned as well about Meet the Employer sessions. We encourage our partner employers and employers who would like to join on board as well to become our partner employers. This is a good way to start with letting the IENs pre-arrival, who are still in their home country, and those who are post-arrival in Ontario, to learn about those organizations and to understand that they are welcoming organization. They're ready to tailor the onboarding, the orientation to the needs of those IENs, and to ensure that it's mutually kind of understanding the background, the cultures, and the workplace transition. So hopefully we're good on time. So I'm gonna speak a little bit more about our mentoring program. So our mentoring program started like years, I think more than 7-8 years, more than this. But during it was the observational job shadowing, which is, there's no hands-on. It's just 2 to 3 days in-person shifts with an expert nurse we call the mentor. In order not to put a pressure on the actually what an expert nurse required to do. It's just to help the IEN understand the specific workplace setting, the expertise in, let's say, we can match them and buddy them with a diabetic nurse educator. We can actually do another clinical setting like critical care nursing, mental health. We're working with so many associations and employers to ensure that IENs will receive a broader understanding of the different healthcare setting in Canada and match their expertise as well they bring. During the pandemic, because everything was shut down and we were not able to match our IENs with the expert nurses in person, we had actually created and developed the virtual mentoring, which is an 3 to 4 online meetings mutually agreed between the mentee, who is the IEN, and the mentor, who is the expert nurse, who actually work on certain learning plan. We have an excellent mentoring team lead, Lourdes, in our team, and she works hand in hand with IENs and with the expert nurses to put this matching properly together. And we always encourage our IENs. This is a great opportunity, not only for them to understand the healthcare setting, but also and the role and the scope of the nurses in practice, but also it's an opportunity to see if this organization fits their goals, or if the organization as well, they kind of find the potential employee. And this is happening. Like, we have success stories where they choose actually to match and to offer a recruitment job offer to the IEN after the mentoring program. So delightfully, I mentioned that I'm going to go through this. We reached to this value of networking and mentorship. So definitely IENs moving to a new setting, it's a bit of not a challenge, but it's sometimes they feel hesitant of what can be done and what cannot be done, what can be said and what cannot be said. Do I actually kind of verbalize and express that I lack knowledge and understanding of this competency or the skill? But when they are in this mentorship program, they are more in their comfort zone because they're not being judged for that. They're just kind of asking the question they need to learn and know about this clinical setting or this healthcare setting. So there's more increased competency and confidence. They develop, again, their leadership skills by being exposed to the knowledge of the expert nurse and understanding more. There's an expansion of network, especially if they go on the observation job shadowing, though they don't have hands-on, but still they actually in a clinical setting, knowing the team of this clinical setting and understanding as well the facility, the organization they are in. That's an exposure, that's an expansion of network. As I mentioned, enhanced Canadian nursing specific communication skills. As much as we come sometimes as IENs, and I'm saying we because I'm part of this community and I will continue to support my fellow IENs, some of the, even if we studied in the English language, our all educational years, still communicating in the workplace in a Canadian healthcare setting is a totally different thing in terms of verbal reporting, in terms of documentation, in terms of all the other kind of accountabilities that comes with transfer of accountability reports to the various interdisciplinary team members. So all of these are actually supportive. And after like surveying all those who've been in the program for so many years, 100% of the IENs find the virtual mentoring and OG as very valuable. From the mentor side, which is very much rewarding, being a mentor myself for so many years, it's always self-fulfillment. It's always an opportunity to learn. Like as an educator, I always learn from my students when they go and find a new study or go and say like, this is the most recent trends in nursing profession and healthcare. There's always opportunity for growth. It's nice to feel that you're serving the nursing profession through a very meaningful volunteer work. It's definitely pay it forward. Maintain a nursing network through the IENs. They broaden their networks and enhance teaching, leadership, and mentorship skills. Expert nurses are always willing to continue mentoring IENs. This is what we found from our as well evaluation surveys. Expert nurses find the expertise, the experience valuable, the whole experience, and find IENs very expert in their specific clinical specialization areas.
So we have a very short video to play, and my fingers are being crossed now. This did work in in our trial run.
Hello, I'm Iris Marie Soares, currently pursuing a registration with the College of Nurses of Ontario. I completed virtual mentoring in the mental health unit and observational job shadowing with the clinical resource team in Trivium Health Partners. What I appreciate in virtual mentoring is the chance to converse with an expert nurse quite experienced in their field. Hearing familiar medications, nursing procedures reminded me of my passion. It is also flexible because there is no need for travel. a great option for someone who lives far and still be able to connect and access with an expert nurse. Observational job shadowing is done in person, and it was my window to reality. I love the chance to be at the unit and observe the expert nurses' day-to-day activities. The chance to interact with other nursing professionals about their varying perspective on the profession, learning about hospital protocols, and observing nursing procedures firsthand was engaging. Speaking with the expert nurses, I was able to identify the areas I'd like to study further, which is mental health and pediatrics. It also encouraged me to pursue acute care. The experience increased my desire to be part of the healthcare team in the future, and I am quite excited about that. Lastly, I would highly recommend virtual mentoring and job shadowing to all IENs, especially to the ones who are not confident or maybe hesitant about their skills, because it gives you the push and the boost of confidence. Also, it gives you the opportunity to reflect on your work experience and see which field you should pursue. Thank you and have a great conference.
So she was moving in the video. I'm not sure why the screen was paused, but we'll take what we can get. At least we heard the audio.
So I'm just going to kind of wrap on the mentoring program and move forward with the next slides. Thank you so much, Meghan. It was really inspirational to hear Iris in this, and was supposed to share as well this video in so many conferences. So yeah, we still do this because we find it a very successful story as well and inspirational for other IENs. So in this slide, it shows the diversity and the, I would say, in the experiences that IENs would be exposed through our mentoring program, because we do not only just refer them to acute care setting, and with all these list of partnership, you can find them on our website. We take, we're very proud in this. We take so much as well value in our partner organizations and employers for having the trust and the confidence in the support we bring together collaboratively. So we also partner with the community care areas like Victorian Order of Nurses and Access Alliance and Care Partners and Bayshore Health and all the other on the list as well, so I will not miss any of them. In the long-term care, as Meghan had mentioned, we always kind of encourage our IENs to explore this area further, because they come sometimes from healthcare system that do not support long-term care facilities. So the concept of long-term care is not very well explored. So we always encourage them to do so through our guidance, through our mentoring, as I mentioned, and through our employment referrals. Nursing associations, and we as well happy to work hand in hand with the 3 Association Ontario, and Meghan, with her position as the pre-arrival coordinator, she is on being the star of the contact person with all the regulators in the other provinces from the west to the east, I would say. So moving to the next slide, please. Thank you. So as we mentioned, for our partner employers and stakeholders and those who are actually having their question in their minds, like why Care Center for IENs, why we're here today, and what is actually there in this kind of webinar. We do actually support employers, though our funding comes from the Ministry of Labour, Immigration Training, Skill Development in Ontario, and from IRCC, and for the past program, the pre-arrival. We still actually kind of support employers. The funding comes for IENs, but we support because we believe this is actually a collaborative work, as I mentioned. So we encourage our employers to join on a Meet the Employer session. We had done a lot of those successful where they do sometimes screening for some of the positions. They call their managers to be part of the Meet the Employer, where they actually speak about what is it working in the organization, how the organization would support in the ASPAP, how the organization supports in the temp license. So there's a lot of value on those Meet the Employer session, mutually for IENs and for the employer. It's an opportunity to recruit. It's an opportunity to highlight the organizations, because some IENs might not know about the positions and the job opportunities that are there, and even about the areas. I still remember the Kingston Health Sciences Meet the Employer session. I was so thrilled by all the kind of amenities and all the support from the community. And I guess there's a lot out there in Ontario to explore in terms of communities and work to establish a community and a career there. And finally, I think we come to the last slide, which is actually summarize all what we spoke about, Meghan and myself. So what inclusion means for IENs, what inclusion means for employers, what inclusion means to the Canadian healthcare workforce. So it means a lot. It means that IENs, they will get the opportunity through our programs and other programs that support the transition to have an access to the healthcare organizations, bridging program, regulators, employment and settlement. They will focus on a non-clinical culture integration. We don't like to use soft skills, but we use it because this is how people get to know it. But I think like more about how to communicate and how to integrate and what do you need of skills and competencies to be actually included in the workplace, how to be assertive and so on. Employers, there's a more increased IEN retention with the workplace transition programs that we offer, more utilization of the IEN skill sets to the, as I said, to the optimal potential of those skills and their areas of specialization, ensure ethical recruitment by valuing equity, diversity, and inclusion, and I would add belonging to the place and having diverse workforce, serving multicultural patient population, especially with aging population. And there's actually, I just came to my mind, I was in this conference last Friday. Sorry, I have to mention this. It's about building an inclusive a community at Scarborough, and it was in affiliation with the UFT in Scarborough. And all what was mentioned about this, like in long-term care, for example, they need more linguistics because of with aging, they feel more comfortable, like the senior population, to speak with the same language or understand the culture. So having a diverse healthcare providers would be of great value to those residents, for example, in the long-term care. Workforce, fostering full IEN contribution to the healthcare sector, filling staffing gaps, which as Meghan mentioned, it's growing, it's more and more. The gaps is getting wider, building workforce capacity in specialized settings, especially in those intensive care, pediatric and geriatric. And we've been working with 4 hospitals. I don't want to forget any of them, but they had a pathway to a critical care from being a personal support worker to become an RPN and an RN, which we work with them. They screened our IENs, they actually enrolled them in the program and the pathway, and we have a lot of successful stories as well. Crucial IEN role serving diverse patients, and I mentioned already this, from post-arrival supports, provincial navigation offices, and IEN support programs, which I already mentioned about our STARS program, pre-arrival as well. Meghan would be more than happy to support and to answer to any questions. So the IEN journey does not end at registration. And first Canadian employment, long-term integration, I would say inclusion requires continuous support and leveraging leadership opportunities. And I've heard it from a professor as well in academia. If we need to nurture the next generation of nurses, we need more of professors, more of educators. And I think a lot of IENs come with those backgrounds as well, including myself. So why not? Let them be actually prepared to take those leadership positions. Thank you.
So thank you so much, everyone. I've included my email here. Please don't hesitate to reach out. Rola and I have also included the email of our STARS post-arrival program in Ontario, our intake coordinator, or client engagement lead, Gilda, but you can direct any questions about PAST or STARS to me as well, and I'll be happy to make sure you get the appropriate answer and the person to contact.
Thank you so much, Rola and Meghan, and thank you for taking us on that journey of IENs, and so wonderful to hear the lived experience voice of Iris. And I'm sure we'll be able to share that video with our members so that they'll be able to see it in its entirety. We do have some questions coming in, and like usual, we have lots of questions from our audience, and if we don't have time to get to all of them, we're happy to bring those forward to our presenters today so that those can be answered. So we'll dive right into the questions and we'll get started. So does CARE still offer any support to IENs who are struggling within some of the ministry programs like SPEP? Can employers reach out to case managers?
I'm gonna take this since it is in Ontario and under the STARS program. So thank you for the question, Julie McShane, and I guess we work together on the piloting of the evidence of practice. And yes, the answer to the question, we do actually offer the support. And we just had a meeting yesterday with the case managers team, and we are going beyond just kind of referring to SPAP programs. We always have the time and the bandwidth and the capacity in our case management team for the one-on-one case management to follow up with the preceptors, the managers, with the permission of the IEN and with the permission of the organization. Definitely will do the support. Please reach out to our team and we'll be happy to support you and the IENs. Yeah.
Thank you, Rola and Meghan. Did you want to add anything to that or answered?
No, I think that covers it nicely. If we're allowed to answer out of order, I just saw a question.
Pick and choose away.
I'm so sorry. I just saw a really easy one to answer.
Yes.
We've asked about the support in Nova Scotia for internationally educated nurses. So I'm going to put the link to ISAMS in the chat. The Immigrant Services Association of Nova Scotia does an excellent IEN program. Please reach out to them. And that actually does lead to the next question, I believe, from Taylor, which I'm happy. Should I read that out, Colleen? I
Absolutely. Go ahead, Meghan. Yeah, jump in and tackle.
Oh, perfect. So the question is, some internationally educated nurses are applying in Nova Scotia, applying first to be licensed in New York and then transfer their RN licensure to Nova Scotia. Is this the best way to get your license when experiencing delays? Do you know much about transferring RN licenses from the US to Canada? So for Nova Scotia, the United States is one of the designated countries where you can practice unrestricted if you pass the NCLEX. So yeah, it would definitely make sense if you're from one of the source country or the countries of education where that would be doable. That absolutely would shorten the licensure journey, especially if you've already passed the licensure exam in the US. A little bit sidetracked, but nurses I've noticed over the last couple of years who are coming specifically to Ontario are also applying to take a license, applying for a nursing assessment in the US to get earlier eligibility to take the NCLEX. Because for the College of Nurses of Ontario, if you pass the NCLEX in another jurisdiction, that was meeting education equivalency. So yeah, applicants are good about finding, designated licensure pathways and shortcuts and navigating that process themselves. So yeah, I hope that answered your question. You can go to the Nova Scotia College of Nurses website, and they have specific information on the designated countries pathway, which includes the US and the steps you would have to take to apply through that pathway.
Thank you so much, Meghan. You're making this easy on me. So we have a couple more questions left. So would there still be a benefit for an IEN to join CARE if they are already registered? Do you have specific long-term integration supports?
I'll let Rola take that one.
Yeah, I'm so ready for it, definitely. As I mentioned in the presentation, it's a journey, and it is from pre-registration to post-registration to employment and to advancing the career. So yes, there's always benefit for the IENs to continue working because it's a lifetime membership at Care Center, and we always encourage IENs to come to share. We work hand in hand with them because, as I mentioned, they feel the comfort zone to speak to our case managers, to share if there is any concerns regarding their workplace transition. And even when they go back, sometimes after like working for 1 year, some, for example, will be registered practical nurses and they will be looking forward for the registered nursing. So we help them and support them. Some of them, they will want to advance their career on getting more certificates like post their registration, like diabetes. So we always kind of encourage our IENs to become members. It doesn't stop as they become registered. It actually continuously, this support is offered for them. We are more than happy to continue supporting them through their career journey and advancing their career. Adding to this, the networking, the referrals that we do, the employment strategies workshops that we have, the technical skills workshop regarding wound care, IV therapy. I know most of the facilities and organizations, they offer this, but we tailor them to our IENs. We have a lot of hands-on time and capacity for them in terms of they will take their time to get into those things. Like we give them, I know in a very fast track environment in the hospital, it's not easy for preceptors to spend that time, I would say, with an IEN to take her through an IV pump, for example, for so many times. For us, we have our employer partners who offer to have these sessions at their sites. We show them the IV pumps, we work with them, and it was really a very, I would say, valuable experience for the IENs. And it's helpful for the organization as well, because they will be trusted that this has actually been a competency that's been built.
Thank you so much, Rola. And I can't believe our hour has gone by so quickly. I think we will definitely have to have a spin-off webinar and continue our discussion. As I mentioned, we will bring any questions forward that we didn't have an opportunity to answer today. And I just wanted to send a big thank you out to the both of you for presenting with N4 today. We greatly appreciate it. And obviously a big thank you to those who attended the webinar today and asked all these fantastic questions. I do hope you all will join us at future webinars and stay tuned for some fantastic topics coming your way. Thank you so much. And we will see you at the next webinar. And I'll hand it back to Rola and Meghan for any last words before we sign off. Thank you.
I just want to thank everybody for joining us today, and please don't hesitate to reach out with any questions. And Rola, did you have anything else?
I will add my voice to yours and echo the same things. I say thank you, everyone. Thank you, N4. Thank you, our stakeholders, employer partners, IENs who actually been on the call, and we'll be ready to actually answer any questions come our way through N4 team. Thank you so much, Colin and Andrew as well for your support.
Thank you so much. And we'll see you at our next webinar. Have a lovely afternoon.
Bye,
Thank
everyone.
you.